Hello, I'm Brian Podany, Police Chief and Safety Services Manager for the City of Blaine, Minnesota. Recently, our great Blaine community has been affected by tragedy as we have lost multiple teenagers to suicide. Our hearts are with the family and friends of those we have lost, and we're actively working with our schools and other community members in response to and prevention of further tragedies such as this. As part of that, we at the Blaine Police Department would like to share with you some helpful ideas to be aware of as parents, guardians, caregivers, and friends of our youth. Risk factors and things to watch for. There are multiple risk factors to be cognizant of and watch for in consideration of increasing the risk of suicidal thoughts or behaviors, including the following: mental health disorders such as depression, anxiety, and other mood disorders, alcohol and substance use, impulsive behaviors, history of trauma or abuse, major loss such as breakup or death, peer or social pressure, humiliation, chronic pain or medical conditions, family or social history of suicide, and previous suicide attempts. Not everyone exhibits the same signs that they're thinking about suicide, but these warning signs are further cause for concern. Physical changes in appearance or hygiene, an increase in alcohol or drug use, sudden drop in grades, social withdrawal, talking about suicide or preoccupation with death, risky or reckless behaviors such as reckless driving or unsafe sex, self-harm behaviors such as cutting, talking about feeling hopeless or having nothing to live for, and researching suicide methods and/or acquiring weapons. Taking action. If you suspect that there may be a problem or are concerned about someone, there are many ideas on how to help and actions to take. We encourage you to consider any sense of stigma about mental health care and voice to your kids or loved ones that it's healthy to ask for help and even model it yourself. Don't let your teens' depression or anxiety snowball. 9 out of 10 teens who take their own lives met criteria for a diagnosis of psychiatric or mental health condition or disorder. Don't wait for them to come to us with their problems or concerns. Approach them. One approach may be, you seem sad. Would you like to talk about it? Maybe I can help. Listen, even when your teen is not talking. Most kids thinking about suicide tip off their troubled state of mind through troubled behaviors and actions, many of which I previously mentioned. Never shrug off threats of suicide as teenage melodrama. Treat verbal statements and actions seriously. Often threats of suicide are a desperate plea for help that should be taken seriously. Trust your judgment and intuition. However, be compassionate and maintain connection and communication with them. Share your feelings. Let them know that everyone feels sad, depressed, or anxious from time to time. Reassure them that things can and will get better and bad times don't last forever. Encourage them not to isolate themselves, but don't push too hard if they resist. It's usually better to be around others rather than alone. Connecting with others, talk to other parents and teachers about ways to help your teens cope. It's helpful for all involved to ensure the well-being of our youth in stressful times. Recommend exercise. Physical activity can stop or delay mild to moderate depression. If their behavior concerns you and you don't want to contact their pediatrician, contact a local mental health provider who works with children. They can do an evaluation and possibly start therapy or counseling. If they are actively suicidal or in danger of self-harm, call 911 or get them to the local emergency room for immediate care. It's additionally important to mitigate the risks and means of suicide. If you have guns or other weapons, ensure they are locked up safely, restricting access. Lock up any medications and take old prescription medications to prescription drug drop boxes located at most local law enforcement agencies, including the Blaine Police Department. Gun locks and lock boxes are readily available and can even be ordered on Amazon. We can even provide you with gun locks for free from the Blaine Police Department. Any way you can slow down the means of suicide, often referred to as means restriction, is important. If there is not access to means, a person will likely be delayed in their plan, during which time they may get the help they need or the impulse may pass. They could also choose a less lethal means and be more likely to survive a suicide attempt. I understand that some may feel that if you eliminate one method, others will be found. However, studies have shown that putting as much time, distance, and trouble between an at-risk person and means can mean saving their life. Communicating concerns. I would like you to encourage students to communicate concerns like suicide plans that they've heard about to their school resource officer or a trusted adult. Our school resource officers are not only in the school to uphold the law, but to provide assistance, care, and referral for kids in the school. The majority of their time is actually spent on general welfare and assistance to the kids at our schools. If a school resource officer does become aware of a student who is at risk, there are a number of things they can do. The officer can conduct a welfare check and work with the student or their family to get in immediate touch with crisis counseling and mental health services. Nobody gets in trouble for asking for help, and if you are concerned, a report can be made and at least looked into. I want to reiterate that the school staff and our officers are there to help people and try to ensure their safety. Crisis contacts. There are a number of mental crisis contacts that we can provide to you. For emergencies, please call 911 to be put in contact with the Blaine Police Department or your local law enforcement agency. Canvas Health also provides 24-hour mobile crisis response for Anoka County residents, and they can be reached at 763-755-3801. Or lastly, the National Suicide Prevention Lifeline phone number is 1-800-273-8255. I would like to thank our Blaine Police Department therapist Marie Ridgway, HealthyChildren.org, and the American Psychological Association for some of the reference material in this presentation. Thank you, and together we will help to ensure a safe, bright future for our youth.